it might be susceptible to that or early. So among all the things that you mentioned, probably the only thing I do or would ask people to try out is the Singular, the leukotriene. But in terms of vitamin E, I don't really subscribe to that.
Okay. When you said you do order imaging sometimes, is it more of an MRI that you would order at that time to see the position of the implant or integrity?
I think for silicone breast implants, MRI is much more useful.
Okay.
And then it would just depend on the insurance, if it'll be covered by the insurance or not, because sometimes for cosmetic procedures, the insurance may or may not cover that.
Right.
But I think MRI is a better modality. If the insurance doesn't accept MRI, then I still want imaging, I may just opt for a CT scan.
Oh, really? Okay. So, just assuming that your patients, the ones who come for the optional plastic surgery breast augmentation, this MRI or the CT, majority of the times is going to be out of pocket. So, how do they respond to getting that done? Are they pretty diligent, or do they skip?
In my population, most of them just bypass it unless I feel like I really, really need it. But it depends on are you talking for like a revision work of a capsular contracture type?
Yeah, I'm talking about, say, if you want to assess a capsular contracture and before going back into another capsulectomy with a replacement of the implant, doesn't insurance need some kind of imaging proof in order to do that? And at least that's what I was told, that you need to have some kind of documented imaging to prove that there was indeed a contracture of the capsule, and MRI is done for that. But
I think ideally speaking, that would be great to get an MRI for insurance to cover it and have all that before proceeding with surgery. I'll be honest with you, I don't know that insurance would keep me from going to surgery to remove something or to, let's say in the breast cancer scenario, everything would be covered, right?
Correct.
Because everything is a quality of breast cancer. So in a cosmetic situation where someone had a previous breast augmentation with silicone and then many years later it comes back with a capsular contracture, I don't think I would make the patient, if the insurance didn't pay for a MRI and this is otherwise a cosmetic thing, they're not going to be paying for the surgery either. So there's really no restriction in taking them to the operating room since all of it's going to be out of pocket. So if the imaging is out of pocket as well, there's I think it would be very few people who would pay for imaging in that scenario. And that, as I said before, it's a clinical decision, and getting this type of imaging, it's nice, but you kind of rely on your clinical judgment.
Okay. Can I ask you one more question? Is that, say, in terms of, let's think of the purely cosmetic patient. What I understand is if FDA allows for MRI screening or surveillance post-augmentation every alternate year after the augmentation is done. So how do you survey or how do you manage these patients in the off years? So every alternate year, yes, she can get an MR, but what about in between? Would you consider